Welcome to Washington Hospital Today, dedicated to informing residents about healthcare topics and issues. Through programs featuring community forums and free health and wellness classes, our goal is to empower community members with the information needed to make informed health decisions. Washington Hospital has been providing health care to the residents of the Washington Township Healthcare District for the past 60 years. Hello, welcome to today's presentation, Stroke Awareness, Risk Factors and Prevention, presented by Dr. Jack Rose, neurosurgeon with Washington Township Medical Foundation. Dr. Rose is an expert in neurointensive care and cerebrovascular disease and was among the first 100 physicians in the world to become board certified in neuroclinical care. He is also board certified in neurology as well as vascular neurology. Please welcome Dr. Jack Rose.
Thank you very much, Christy, and good afternoon, everybody. Today I'm going to be talking to you about warning signs and prevention of stroke, and a little bit about stroke treatment as well. Well, what is stroke is a major health problem in the United States as well as the world. In the United States, we have close to 800,000 people affected by stroke every year. Stroke is the fifth leading cause of death in the United States, and that translates to one person dies of a stroke every 4 minutes. There are a large number of people that survive stroke, over 5 million in the United States today. And importantly, stroke is the number one cause of serious long-term disability in adults. Stroke affects, stroke is a very costly health problem as well. It's been estimated to cost the United States over $30 billion a year. Almost a fifth or approximately 1/5 of patients that have a stroke are institutionalized within the 3 months after their stroke. And a fifth to a quarter of men or women will die within 1 year after having a stroke. Also, only a subset of people that survive a stroke will be able to regain their full function after having a stroke. Stroke also disparately affects African Americans, which are people who have a higher chance of having stroke than Caucasian Americans, and twice as many as Asians or Hispanics. Stroke also affects women significantly and kills more American women every year than breast cancer does. And women have a higher chance of dying after surviving a stroke. And women who are over the age of 30 and smoke, in combination with oral contraceptive use, have over a 22-time higher risk of having a stroke. Well, what is a stroke? Stroke is a brain attack. So it's an illness that happens in the brain, not in the heart. So as opposed to a heart attack, stroke, we call it a brain attack. It's also a medical emergency. So if you or someone you love, someone that's next to you, a coworker, a friend, a neighbor, you think is having a stroke, you need to call 911 for emergency treatment. A little bit more specifically about stroke. A stroke occurs when a blood vessel that gives blood to the brain, an artery, gets blocked or breaks, and that affects blood flow to that portion or the entire brain. And as a result, the brain tissue that's supposed to be getting the blood flow from that artery can die or become injured, which causes a problem with brain function. There are two main types of stroke. The most common type of stroke is what we call ischemic stroke, and that's about 80% of all strokes. That's a blocked artery or a narrowed artery type stroke. And that's where the blood flow to the particular part of the brain from a narrowed or blocked artery is impaired. And the brain cells from that area then will die from the lack of getting oxygenated blood flow and the other nutrients that the blood brings to the brain. This is a cartoon diagram showing you what a blood clot would look like here in this cartoon down here, which is a blow up of this artery, this tube here, bringing blood flow to the brain. And if it gets blocked by a clot, then the portion of the brain beyond that that's supposed to be getting blood flow can get injured or die. This is a picture test, a CAT scan, or a special type of X-ray picture of the brain, showing you after someone has a stroke in this particular area of the brain, you see this area of black. That's an area of brain that has the brain tissue has died, and now it's replaced by fluid. So whereas the normal brain is nice and gray, this is an area of blackness showing you that this area of the brain has been permanently injured. This happens to be a small stroke, but strokes can be very large as well. This is an example of a very large ischemic or blocked artery stroke. You see that this large area of blackness here is the result of a large brain artery that got blocked and was not able to be opened up in time to save this part of the brain. And you notice that it's close to half of the size of the brain itself, and it's also pushing on the normal unaffected side of the brain, causing a significant impairment of brain function, and this size of a stroke is often fatal. The other main type of stroke, about the other 20% of strokes, are bleeding strokes, or we call them hemorrhagic strokes. And that's where you have an artery that breaks inside the head, and it leads to bleeding inside the brain tissue or in the fluid spaces that are next to the brain. This is an example of a small bleeding stroke. You see here this area of whiteness deep down in the center of the brain. That's acute bleeding, a small bleeding stroke in the deep part of the brain. And this is something that can be recovered from if it stays this small. But bleeding strokes, just like blocked artery strokes, can be quite large as well from the very beginning. And this amount of bleeding can happen in a number of seconds to minutes. And a bleeding stroke of this size is difficult to survive, and if survived, is often associated with very severe neurological disability after survival. What causes bleeding strokes? I told you that the more common blocked artery strokes are caused by artery blockages or narrowing. Well, bleeding strokes are caused by broken arteries in the head. Sometimes it's caused by something we call an aneurysm, which is an abnormal circular ballooning of a weakened region of a brain artery. But you can also have bleeding strokes from just very small arteries that break from long-time high blood pressure, or you can get bleeding strokes from something called an AVM, which is a cluster of abnormal blood vessels where an artery in the head is directly connected to a vein in the head, which can lead to bleeding. This is a cartoon example of which arteries are involved in high blood pressure associated bleeding strokes. These small arteries here over time see a lot of abnormal high pressure from too much blood pressure, and they can break and lead to bleeding into the tissue deep inside the brain. Now, are there any warning signs of stroke? Well, there's something called a TIA, or a transient ischemic attack. TIAs are warning signs of stroke that can or may happen before a more permanent stroke. TIAs are not mini strokes, but they are warning signs of stroke. They occur when blood flow is blocked in a brain artery or a neck artery, for example, but it's only blocked for a temporary or a short period of time. The blood flow then spontaneously resumes normally, and the patient is only affected temporarily. But this is a medical emergency just like stroke is, because after a TIA, people are at high risk for having a stroke, which can lead to permanent brain damage. And TIAs are quite common as well. They affect almost 250,000 people every year in the United States. And like I said, they can be a harbinger or a warning sign of a stroke to come. People that have TIAs are almost 10 times more likely to have a stroke in the number of days or weeks that follow a TIA. So what are the things that happen to people when they have a stroke or a TIA? Well, sudden numbness or weakness, especially on one side of the body, the face, the arm, or the leg, or all three, that could be a warning sign of a stroke or a TIA. Sudden confusion or trouble speaking or understanding, some acute problem with your language, it could be a sign of a TIA or a stroke, as is sudden problem with vision, especially out of one eye, or sometimes about half of the visual world on one side. That can be a warning sign of a stroke or a TIA. Also, a stroke or TIA can suddenly cause inability to walk at all, or in a coordinated fashion, or stand up and be well balanced, or sudden room spinning, or a particular type of dizziness called vertigo. Then rarely, headache is a sign of stroke or TIA. Actually, not TIA, but bleeding strokes can cause severe headache. But blocked artery strokes, which are the much more common types of stroke, are often not associated with any pain. And we spend a lot of time to try to educate people about this because unlike heart attacks, where a lot of people have crushing chest pain and then immediately call 911 or have 911 called for them, most strokes are not associated with headache or pain, and so sometimes the beginning of them can be harder to recognize and get the medical attention that's needed. There is an easier way to remember these stroke signs, to be able to recognize when you or a loved one or a colleague or a neighbor might be having a stroke, and we use the acronym BFAST. So B in the BFAST stands for balance. So if suddenly someone loses their ability to balance or to walk in a balanced fashion, that can be a sign of a stroke. E is for eyes, sudden visual loss in one eye or the visual world on one side. Face, look for an uneven smile. If someone suddenly has a drooped face on one side or when they're smiling or talking, only one side of their face is moving, that can be a sign of a stroke. A is for arm. So if someone suddenly has weakness on one of their arms, or when you ask them to hold up their arms and one arm drops down, they can't hold it up, that can be a sign of a stroke, especially if there's no neck or shoulder or headache. S is for speech, so any sudden slurred speech or problem with language, either articulating language or understanding what's being said to them. That S is for speech. That could be a common sign of a stroke. And then T is for time. So it's important to call 911 if you suspect stroke in yourself or anyone around you, because the faster you can recognize the problem and get to medical attention, the better your chance of having as minimal neurological disability and hopefully full recovery. And this just is a cartoon showing you that things in the brain are crossed in terms of the left side of the brain controls things on the right side of the body. So someone with a stroke on their left side of their brain may be paralyzed on their right side. Most patients' language is in the left side of their brain, and so if someone has a stroke in the left side of their brain, they oftentimes will have language problem. And on the right side of the brain, the left side of the body may be paralyzed. They may not be able to understand that they're weak on that side, and they may have abnormal behavior as well. This is a cartoon diagram showing you what looks like when someone has a weakness on the right side of their face. Here's the normal picture here, and here's the picture when the person is asked to smile. And you notice that the person's left side of the face moves up in a normal fashion, but the right side doesn't move. It seems paralyzed and crooked. So that could be a sign of a stroke on the left side of the brain. This is an example of a suddenly weak right arm. This woman is being asked to hold up her arms, and without a stroke, she's able to hold up both of her arms and keep them up. But here, the right arm is drifting down, and she's unable to maintain it being raised up. So again, if you suspect a stroke, call 911, because every minute or even seconds that are lost, you can potentially have permanent brain injury, or time lost equals brain loss. Fortunately, we do have treatments for strokes if we can recognize them quickly. Ischemic strokes we can treat by giving a clot-busting medicine. We call that TPA, and it requires a very rapid diagnosis in the emergency room, and it has to be given in an IV, and has to be given within 4.5 hours from when the stroke symptoms occurred. And when someone comes to the hospital with a suspected blocked artery stroke, we first make sure it's not a bleeding stroke, and then if it's not a bleeding stroke, we try to give this clot-busting medicine within 30 to 60 minutes of the patient being brought to the emergency department. So the treatment is given very, very rapidly, but a lot of tests have to occur first to make sure we're dealing with a blocked artery stroke. Sometimes our blocked artery stroke patients have such a big blockage in a major artery of their brain that we need to do more than just giving a medicine to try to open up that blocked artery. And sometimes we can actually take the person to a procedure where we take the person to a neurological cath lab and put a small catheter into the blocked brain artery and remove it, doing a procedure with a tiny device. That is done through a small incision in the groin. So it's a type of brain surgery that's done through a small incision in the groin with tiny catheters. But this can be very, very helpful and effective at opening up large blocked arteries in the brain. But these procedures have to be done rapidly and at a hospital that's ready to do so. Once patients have had a stroke, we have other medical measures and other measures that we can do to prevent another stroke. We will typically prescribe certain medications, such as blood thinners. If the stroke is caused by a significant narrowing of one of their neck arteries, called the carotid artery, if it's narrowed to a certain amount and caused a stroke that's not too big, sometimes a surgery in the neck will be done to open up that blockage. Sometimes instead of an open surgery in the neck, we can actually do the same type of narrowed artery opening from inside the artery with a stent procedure. And there's lots of other ways that we can prevent the next stroke, and we'll go over that in a little bit later in the talk. What about bleeding strokes? Can we treat bleeding strokes? Well, the answer is sometimes. It depends on what type of bleeding stroke it is, where it's located, and how severe it is. Patients that have a bleeding stroke from a ruptured brain aneurysm or a ruptured AVM, we can actually do a neurosurgical procedure that's called clipping or coiling. Clipping is actually doing an open brain surgery procedure where the aneurysm that broke is identified in brain surgery, and then a metal clip is put over the broken blister. Coiling is the same technique that is used to open up large blocked arteries for blocked artery strokes, but instead of removing a clot, we're putting tiny metal pieces inside the ruptured aneurysm so that aneurysm no longer fills with blood and won't break anymore. We have expert neurosurgeons here at our hospital that are able to do both of these type of surgery for bleeding strokes. Actually, the most common type of bleeding stroke from long-standing high blood pressure, we do not have a surgical treatment for, and our medical measures are only very modestly helpful. Washington Hospital is one of the primary certified stroke centers in the Bay Area and has been so for many years. And we adhere to the national guidelines and have received numerous awards for adherence to high-quality stroke care. Stroke patients also benefit very much from rehabilitation after their stroke to try to get back all of the problems with their brain and body function. The rehabilitation starts right after the patient is admitted to the hospital and treated, but sometimes patients will need to be discharged or sent to an acute rehab facility or even a nursing home for some much longer rehabilitation. And the rehabilitation can continue once patients get home, either in the home or through outpatient therapy. So to go over what we've learned so far about stroke or reviewed is that it is a serious disease. It unfortunately still can be fatal, and it disables a large number of survivors. But the good news is that it can be detected early. Remember that BFAST acronym. It's treatable. But time is crucial. It's a medical emergency. So remember the warning signs of stroke. Remember this BFAST mnemonic: sudden numbness, sudden confusion or trouble speaking, sudden visual trouble, sudden walking disability or dizziness, a sudden severe headache that's not known to be from something else like migraine. These are all warning signs of stroke. So if you suspect stroke, remember, don't try to diagnose it yourself. Call 911, have EMS come and evaluate and bring the patient to the hospital immediately. And we'll share this again at the end of the talk, but if you want to learn more about stroke and our stroke program here at Washington Hospital, please visit our website, www.whhs.com/stroke. The other good thing or good news, if there is any, about strokes is that they're very preventable. So, and the risk factors are not that complicated. So basically the same types of medical problems and illnesses that can lead to heart attack can lead to stroke. The biggest one of those is high blood pressure or hypertension. So hypertension is probably the most significant risk factor for stroke. High cholesterol, which is primarily a genetic problem, but diet and exercise plays a role as well. So if your cholesterol is abnormally high for many years, it increases your chance for having a stroke, both blocked artery strokes and bleeding strokes. More so high blood pressure for the bleeding strokes, but high cholesterol certainly for blocked artery strokes. Smoking is a huge risk for both major types of stroke. Atrial fibrillation is a particular heart arrhythmia where the top part of the heart, instead of beating in a nice, regular, coordinated fashion, will fibrillate or quiver. and the blood that goes into that top chamber of the quivering heart swirls around there and doesn't leave rapidly like it's supposed to. And so swirling blood in that quivering top chamber of the heart, blood clots can develop there. And then when the heart goes back into a more normal beating rhythm, the clots can go up to the brain and cause stroke. That is a major cause of stroke in people in their 60s, 70s, and much older. And unfortunately, people that have strokes from atrial fibrillation have more severe strokes. And atrial fibrillation is something that's becoming much more prevalent in our aging population. Heavy alcohol use is also a terrible thing for the health of your blood vessels anywhere in your body, but also in the brain and the neck, and can lead to strokes. So it's estimated that if you control some of these like 5 major risk factors, we could prevent hundreds of thousands of strokes. So if we're able to control hypertension in everybody, it's been estimated that we could prevent over 360,000 strokes a year. If we treated high cholesterol and made sure that patients don't have too high cholesterol, maybe 140,000 patients strokes could be prevented. Smoking cessation could potentially prevent almost 100,000 strokes per year. Treatment of atrial fibrillation with blood thinners and other heart-related treatments can prevent maybe 70,000 strokes per year. And avoiding heavy alcohol use could prevent close to 35,000 strokes per year. So if you add those all up together, it's a high percentage of our strokes we think we could prevent or at least delay by treating these associated medical conditions and risk factors. So prevention is the most important. Yes, we can treat stroke, but the best thing would be to prevent it from ever happening in the first place. So make sure you go to your doctors regularly. Make sure you get your blood pressure checked, not just at the doctor's office. Have it checked a few times a year. And even in the home, if you have high blood pressure or borderline. If your blood pressure is borderline, say it's above 120/80, that's something you want to keep an eye on and track it. And then if it's not getting better with healthy diet and regular exercise and weight loss, you probably should take medications and speak to your physician about that. Keeping your weight down and exercising regularly will help with blood pressure and will also decrease your risk for stroke in the future. Eating healthy, mostly a plant-based diet, minimizing red meat consumption is also very good for minimizing your stroke risk. And obviously never smoking any substance, not just cigarettes. So even marijuana smoking is bad for the blood vessels. So this is just a diagram showing you that each of these risk factors significantly increases your chance for having a stroke than if you don't have these factors. So if you have high blood pressure, your risk of having a stroke is 340% higher. If you have heart artery disease, it also similarly increases your risk for stroke. Heart failure is another risk factor for stroke, as is atrial fibrillation. Notice how significant above the baseline condition of not having atrial fibrillation, your stroke risk is about 500% greater if you have atrial fibrillation. But we do have medicines that can minimize your risk of having a stroke should you happen to have atrial fibrillation. And the medicines we have for most of these conditions nowadays are very good and well tolerated. There are, though, risk factors associated with stroke that we cannot control. The older you are, the increased your chances are of having a stroke. If you're a woman, you tend to have a slightly increased risk for stroke than men, but it's mild. And then your genetic background, heredity, racial and ethnic factors can play a role as well. We can't change that, obviously. And then whether you've had a stroke in the past is actually a strong predictor of increased risk for the future. So people that have had a stroke, even if it's a mild one or a TIA, are at increased risk and should be taking every single possible preventive action so that they are protected against having a future stroke. So again, controlling these well-known modifiable risk factors like smoking and alcohol use and high blood pressure, unhealthy diets, leading a sedentary lifestyle, not being active, not controlling diabetes if you have it. Diabetes is a big risk factor for small artery blockages and small vessel strokes. And you can control knowing what a stroke is and how to recognize it. And that can help make sure that should you be having a warning sign of a stroke or a stroke, that you get to medical attention quickly so that it can be treated optimally. Making sure that your body weight is optimal and well controlled, and avoiding and treating obesity. There are lots of different diets out there. The Mediterranean diet tends to be one of the ones that's most promoted to be healthy and good for both preventing heart disease and brain disease, not just stroke, but dementia even. Eat with the sizable portions. Don't eat too much calories per day. Combine that with regular exercise. Don't do crash diets. You want to do something that can be continued in the long term, and avoiding high sugar, processed, high fat foods and trans fats in your food is very important. Weight reduction is extremely important in terms of stroke prevention, and you may know that obesity is a huge problem in the United States, and the incidence of obesity is continuing to rise despite everybody knowing how bad it is for your health. And it's been estimated by about 2030, maybe about 50% of our adult U.S. population will be obese. So that is something we really need to work on. Smoking cessation is extremely important because it significantly increases your risk for both blocked artery and bleeding strokes. And then anybody that smokes especially should not take hormonal therapies, because combining smoking with hormonal treatments like oral contraceptive pills in women significantly increases the risk for stroke. So how can you stop smoking if you're having a hard time? Sometimes quitting cold turkey is very difficult and challenging, but the good news is that your physician can help you. There are lots of oral medications these days. There are nicotine replacement strategies with patches or gums, and there are smokers' helplines and information online that you can learn about to help stop smoking. And if you live with someone who smokes, or you smoke together, sometimes making a pact to quit together helps. And also avoid situations where people commonly smoke, if that's something you're trying to maintain quitting. So avoid going to bars where people can smoke, etc. Alcohol use, if you don't drink, don't start drinking now. If you do drink, limit your drinking. For men, typical adult-sized men, no more than 1 to 2 drinks a day. For women, no more than 1 drink per day. And if you do drink more than 2 drinks a day, gradually reduce your consumption to minimal. And doing so will really improve your overall health, will improve your weight, it will improve your stroke and heart attack risk. High blood pressure. We think that we can probably prevent about half of strokes, both blocked artery strokes and bleeding strokes, just by controlling high blood pressure. Most organizations, including the American Stroke Association, say that you want to keep your blood pressure always less than 120/80, and that the lower you go, the better. Especially if you have diabetes, you want to be very aggressive with your blood pressure control. Hypertension is a huge problem in America. About 30% of American adults have high blood pressure or hypertension. Yet, only about 50% of patients that have it have their condition under control, despite there being many medicines that are effective. And obesity is a big driver of high blood pressure, and that a large number of American adults are either overweight or meet the medical definition for obesity. What can you do to bring your blood pressure down? Well, exercising regularly, making sure your weight is not excessive, no to moderate and minimal drinking of alcohol, low sodium diets, and following up with your physician about and taking medicines if it's indicated for you to take medicines. If you have high blood pressure, probably not good idea to add salt to your diet. Some people are very sensitive to salt in their diet in terms of keeping their blood pressure elevated. Eat healthy, exercise, and follow your blood pressure regularly at home with a home blood pressure machine. And avoiding a sedentary lifestyle is great for your overall health in general, but for stroke prevention, absolutely. So it's recommended that you get at least 30 minutes of aerobic exercise every day. And that doesn't mean you have to go to the gym or have to be in the pool for a long time every day. But even just walking for a period of time every day will keep you fit and help keep your weight under control, lower your cholesterol level. It's a great stress reliever and lowers your blood pressure. Diabetes is a big risk factor for stroke as well. We have 30 million Americans with diabetes these days, at least, and a large number of people with undiagnosed diabetes. Diabetes is a disorder or a disease where the blood sugar is markedly elevated. Diabetes itself is a very dangerous medical condition and can lead to death from associated problems with kidneys, heart, with your brain. And diabetes can definitely cause damage to brain arteries and lead to stroke. So if you have diabetes, learn about it, work with your physician to get your blood sugars under aggressive, good control, and check out these websites to get much more information, but more importantly, speak to your physician. So again, to reiterate, we really know that stroke can be prevented by using the knowledge that we talked about today, making healthy lifestyle and medical choices, and to be motivated to change, to lead the healthiest lifestyle that you can live, and to be able to recognize what a stroke is, what are warning signs, and how to rapidly get to medical attention should you or anyone around you be having a stroke. We can prevent stroke, treat stroke, and if you're interested in learning more about stroke, you can call this phone number or go to the strokeassociation.org website or our own hospital's stroke program website to learn more about what we're doing here at Washington Hospital.
Thank you so much, Dr. Rose. We do have a few questions. The first is, if damage to the brain occurs during a stroke, will it repair itself?
That's a good question. So once a stroke happens, there is often a part of the brain that is permanently damaged. So that damaged part of the brain, which is hopefully small with treatment, cannot repair itself, but that other parts of the brain have to take over the job of that injured area. And that's why sometimes it takes time, days, weeks, months, sometimes even years, for people to recover from a stroke, because other unaffected parts of the brain have to take over the job for the injured area.
Okay, and the next question is, what is the difference between a brain bleed that may occur from a head trauma different from a brain bleed from a stroke?
Yeah, so you can have bleeding in the head from head trauma, from a car accident, a fall, but that is not technically a stroke. Stroke happens spontaneously from a problem with the blood vessel. Bleeding from a traumatic head injury can be quite serious and sometimes requires brain surgery as well, but that's not an injury of the brain that's related to stroke. So there are different medical conditions that could lead to similar brain injury problems, but head injuries that cause bleeding are not strokes. Sometimes patients with strokes, though, if they're suddenly weak on one side of the body, for example, or suddenly they lose their ability to be balanced, can then fall over and hit their head. So sometimes we can have stroke patients that also have a head injury, and it makes their treatments a little bit more complicated and sometimes make their recovery more challenging.
Okay, and our last question, you mentioned checking your blood pressure regularly at home. What kind of blood pressure machine is good to use at home that I can operate on my own?
Yes, that's a great question. So fortunately these days there are excellent machines that you can get at pretty much any pharmacy or a retail store. The kind you want to get is the kind with the cuff goes around your bicep, the upper part of your arm, not so much the ones that are there that measure your blood pressure from your wrist. They tend to be a little bit less accurate. So you want to get one of these automated machines that you put the cuff around their arm and you push a button and it measures your blood pressure and your heart rate at home. And anybody that has high blood pressure should have that and measure their blood pressure at least 2 times a day. But the other important thing with that is you want to take that machine the first time you get it and bring it to your doctor's office so that you can make sure that it's an accurate machine for you. So you bring it to your doctor's office, you measure your blood pressure, and then have the doctor's office staff measure your blood pressure to make sure that it's accurate for you.
That's great. Now, this does conclude our program. Thank you, Dr. Rose, for this insightful presentation, and thank you, viewers, for tuning in. For more information on Washington Hospital's stroke program, go to whhs.com/stroke. The entire broadcast of today's presentation will be available on our Facebook page and YouTube.